It has been just this year alone, we've had to combat Lassa fever, COVID 19, and now yellow fever. Well, maybe we didn't see COVID 19 coming like a lot of other countries, but for Lassa fever, yellow fever, they're not new to Nigeria's health system. I mean, the NCT says over time, just this year alone, we've had 76 people die across 3 states as a result of this disease. But the big question is, didn't we see this coming? I mean, what did we miss and how can we make it better? We have joining us two commissioners for health across 2 states that are dealing with yellow fever currently in Nigeria. Dr. Onoye Mordi is a commissioner for health, Delta State. It's joined by Dr. Ikechukwu Obi, the commissioner for health in Enugu State. Good morning and thank you for joining us on Sunrise Daily. Well, this is a question for both of you, but I'd like to begin with Dr. Mordi. Here we are again dealing with yellow fever, and I mean, people have died. It's really sad. And the first question a lot of Nigerians usually ask is, didn't we see this coming? I mean, this is not a time to throw around blame games and all that, but it's important to know how we dropped the ball, where we missed it. So regarding the case in your state, how did we get to this point?
Now, we saw this coming. Let me tell you how. There is a planned mass yellow fever vaccination involving some states, like Delta, which was programmed to begin about the 20th of November. So plans were already on ground, adequate plans were on ground to take off mass vaccination of every eligible Delta. And this just came before them. And that is why, as we handle this phase in the first 2 local government areas, we're already working towards actualizing the plans we had for the rest 23 local government areas. And so there were plans before now. Just like these cases came in earlier than when we were to begin the mass vaccination campaign.
Really, this emergency activation once things happen, once maybe a suspected case is discovered. Do you have such in your state?
Oh yes. The moment we got the information, what we did was get into the communities involved actually, to try to first of all engage with the community and be sure of what was going on. Incidentally, the news came in as mysterious deaths, so they thought, those deaths were mysterious. And so when they reported, we went to the community, had discussions with them, and then thereafter set up the necessary machinery to deal with what our suspicions were. We didn't think initially of any particular ailment because of the age bracket involved. 15 to 25 years, most of them were even thinking of substance abuse. We thought of Lassa fever because we're about the analysis of Lassa. We also had a third on our mind of yellow fever, and so we set out trying to identify what was the primary cause of these unexplained deaths.
Let me bring in Dr. Obi now, just to get his opening thoughts on this. I suspect you will also say you saw this coming, but people have died. So the question now is, what could you have done better, with the benefit of hindsight, to maybe save those lives and ensure that the casualty was reduced?
Okay, good morning. Yes, good morning. The truth of it is that we must understand that when it comes to public health issues, for example, yellow fever belongs to one of the diseases you call a disease of public health importance. And the truth of it is that there is always the emergency preparedness and response states for most ministries of health from the federal to the state level also. When you're dealing with diseases that are endemic, sometimes even though you are prepared, it doesn't necessarily mean that you might always be able to cover every single ground at all times. But you see, emergency preparedness is the key, so that once things like this come up, then you can immediately swing into action as much as is possible.
Okay, Dr. Obi, it's been quite tricky catching your trail of thoughts there with the network acting up. But we'll try to reconnect with you such that we can get what you're saying and make some sense of what you're doing in your state. But we'll go to break right now. When we return, we'll take up some issues, especially as it concerns Kogi State. Yesterday, there was a controversy about the death toll. Is it in Kogi? Is it in Enugu? But we'll go on this break right now. And when we return, we'll take on the issues. Please stay with us. So, Dr. Obi, there's been that controversy about the deaths that were reported. Was it in Kogi State? In fact, a member of the State Assembly said over 50 people died in that particular community of Alamaboro. But the commissioner says that it happened on the Enugu side. So, trying to make sense, really, what exactly played out? Is it 50 people? Is it over 40 people? Did it happen in Kogi or in Enugu? If you can hear me, Dr. Obi. Obi, can you hear me?
You can't hear me.
Okay, I think it's much better now. So let me just take the question again. I guess you probably didn't get my question. I'm asking, just yesterday, reports came out about over 50 people dying of yellow fever in a particular community in Kogi State. The commissioner said, well, it didn't happen in Kogi State, that it happened in Enugu State, right? So we need to know, 50 people, is it over 46 people? What exactly played out and which other communities have been affected?
Hello, can you hear me now?
Yes, please, go ahead.
Okay, so we and they were in communities in one of our local governments, Ibweze North local government. And those communities were Eteuno and Umopu communities. Now, they happen to share border with Kogi State. And this activated our own emergency response. And when we now responded and connected with others, we discovered eventually through confirmatory tests that we are dealing with yellow fever. Can you hear me?
Yes, please, go ahead.
Yes, so we are dealing with yellow fever. And we have confirmed that it's yellow fever that we're having, and we had reported cases on the Enugu side. Yes.
How many cases, how many deaths have you recorded on the Enugu side?
Now, if for deaths, we have had reported right now from our situation reports, we have reported a large number of deaths in quite a large number of LGAs. But you see, we are still calling them probable deaths or deaths from probable cases of yellow fever, because we have not confirmed that all these deaths were yellow fever related deaths. The number of deaths we can confirm as due to yellow fever are 2 deaths. Actually, 2 deaths that we can confirm are from yellow fever. And we have confirmed 19 cases of yellow fever based on the PCR diagnosis, and can only confirm 2 deaths from yellow fever. So the reports of strange deaths are ongoing. Now, it's very likely that a lot of the deaths we have reported out of the 127 may have been from yellow fever, but we cannot confirm that all of them are from yellow fever. So it's better we can confirm the 2 deaths that we're sure from samples that were taken that are from.
Specifically speaking, the communities that share boundaries with Kogi State, with Olamabaro, how many suspected deaths or strange deaths have been recorded in the community that shares a border with Kogi? Talking about the Olamabaro community. Dr. Obi, we seem to be having a challenge with your connection, but we'll come back. We'll come back to that in a moment. Hi.
Yes, I wanted to ask Dr. Modi. Well, earlier you said that you saw it coming when my colleague asked you if we saw it coming, that these deaths and all of that. Specifically, what did you see coming? Because down the line, you also said you didn't suspect initially any particular ailment, but that you saw it coming. What exactly did you see coming and when?
Now, nationally, there are planned yellow vaccination campaigns to cover various states, and Delta State is amongst the states that will begin in November. And these plans were made because over time, I think the last time we had a yellow fever coming in Delta was in the mid-90s. So there was already a program, to vaccinate so that people will not contact the virus. But like I said, it's not coming.
It was necessary. Just a moment, Doctor. I'm wondering why it was necessary to do a mass vaccination, given that what we have always known is that people are vaccinated for yellow fever at birth, and it's once in a lifetime. So at what point did we stop vaccinating such that 30 people have died as a result of yellow fever in Delta State?
Vaccinations begin from 9 months. Like I told you, there are routine vaccinations that they take, in the health centers. There are also campaigns that you take to persons who may not have, been exposed to vaccination. Like some persons' health behavior, makes them not to seek services like routine immunization. Like I told you, the last mass vaccination was about mid-90s. And if you look at the age range of those involved in this particular case, you see that they are most likely those who may have missed out the regular routine immunizations, maybe because of the health-seeking behavior of their parents. And so that's why that would have happened. Now, vaccinating the entire population, of course, is very much necessary to give us, what I call herd immunity, and that is proper and normal. And even the way we responded, the speed with which we responded was because we were already preparing. And so we leverage on the preparations we have made.
If there was that significant response, Dr. Modi, from what we understand, there is a gestation period for yellow fever before it could get to the point of killing someone. We understand it takes something upwards of about a week or thereabout before someone could die of yellow fever. If that is the case, and you say that the response was quick enough, how come we were able to get up to 30 people die in Delta if your response was quick enough?
Initially, the communities thought that this mysterious death was because of other reasons. Reasons adduced to maybe dating or.
Does that mean your emergency team didn't get there on time before they discovered the people began to hallucinate about what it could be?
By the time the information came to us, I think we had about 15 deaths. That was on the 30th of October. And by the 31st of October, we were in the community. By that 31st of October, we already began active case search. And even thereafter, there was quite some resistance from some of the communities who still felt that these were not medical issues. And we led to, at that point in time, more robustly engage the community to enable us have access. And in that intervening period, persons that could have also been surveyed lost their lives. And so it wasn't the fault of the medical system, but issues that had to do with the belief system in some of the communities.
Okay, I think we have Dr. Obi back now. As we wind down on this conversation, I was asking earlier, Dr. Obi, that how many deaths were recorded, strange, unaccounted for deaths, in that border community with Alamabaro in Kogi State? How many strange deaths were recorded on your side of that border?
Yes, can you hear me now?
Yes, I can.
Hello, can you hear me now?
Yes, please, go ahead.
Okay, so for the number of deaths, I have said that to determine the numbers of strange deaths, yes, the initial reports were of 50 and above, the numbers of strange deaths. And like Dr. Modi has said, the issues of health-seeking behavior are real. And a lot of times, we have an emergency reporting network that has to deal with the health system. If people do not report to the healthcare system in the primary healthcare facilities, at least, it becomes difficult for for infectious diseases surveillance and response to be initiated. So a lot of times it's health-seeking behavior of people that has to do with a lot of things. Belief systems, people stay away from hospitals thinking that they will get better care from herbalists and from patent medicine vendors sometimes. So, but if they do not report to the health center, it's difficult to determine that a particular type of illness. That is why the first report we had from Enugu State was that we were dealing with strange deaths, that the symptoms resembled diseases of public health importance. Then we went ahead to determine what particular disease we were dealing with.
Right. Dr. Ikechukwu Obi, the Commissioner for Health in Enugu State, thank you so much for your time, as well as Dr. Onoye Modi, the Commissioner for Health in Delta State. We'd like to appreciate you, and we wish you the very best in this battle. Well, let's turn our attention to a matter that has been trending for a while now, and it concerns pensions for ex-governors and their deputies, maybe especially the ones that are now holding political offices or appointments. Don't forget, the Lagos State governor made that announcement, and now we have the Kwara State government also. In fact, that particular law was submitted just yesterday at the State Assembly. So we'll be speaking with the Attorney General and Commissioner for Justice in Kwara State in a moment, just to get a sense of what that law is about, some controversies that were raised, and what it means in general for the state. But that's in a moment. Please stay with us.